Hey guys, I want to talk real quick about participating versus non-participating providers. When we discuss Medicare insurance, there's two main paths. There's obviously original or traditional Medicare. That's the inpatient coverage known as Medicare Part A, and the outpatient coverage known as Medicare Part B. So when you go down the original or traditional Medicare path, you have participating providers. So under this option, participating providers agree to accept assignment on all Medicare claims for all their Medicare patients. So, which means that they have signed a participation agreement with Medicare, agreeing to accept Medicare's fee schedule amounts as payment in full for all Medicare covered services. Medicare beneficiaries see participating providers. Seeing a participating provider can only be liable for the cost sharing required by Medicare. So we all know that Medicare does not cover the full amount. Typically, most folks will know that 80% of most of your hospital or doctor's bills that are accepted by a participating provider, that is billed by a participating provider, will be payment in full, but there is cost sharing for the Medicare beneficiary. Typically it's 80%, and then there's also some deductibles, co-pays, and co-insurance that need to be met if you are needing particular Medicare medical services, supplies, or just other services. So providers have several incentives to be participating providers, such as being paid higher rates, typically around 5% higher than the rates paid to non-participating providers. So according to Kaiser Family Foundation.org, they're a great resource for Medicare data, Medicare information. The vast majority, 97% of the physicians and practitioners billing Medicare, that's original Medicare, not a network-based HMO, PPO, MSA, or PFFS network-based plan. This is original Medicare from the federal government. Then 97% of all the U.S. physicians within the Medicare network, if you will, it's more like a national network, accept assignment from Medicare as payment in full. And that includes practitioners, clinicians, PTs, OTs, and all the other participating providers. And so that's one designation providers can have with traditional Medicare. It's known as fee for service because they do a service and they get paid a fee for it directly. So there is no in between person to get in between the patient and the provider or physician or clinician. The second designation is non-participating provider. So these non-participating providers, the providers in this category, accept Medicare patients, but can choose whether to take assignment. So Medicare approved amount on a claim-by-claim basis. So that means they don't have to sign a participation agreement. They just want to be able to bill Medicare. And like I said earlier, 97% of physicians, practitioners accept assignment from Medicare because it's a higher rate and reimbursement for them. And then also too, with the non-participating providers, there's many YouTubers out there like Tony, who's expert in PT, OT, and teaching those folks how to bill for physical therapy out there. He is on YouTube letting folks know that it's actually is more cumbersome to actually not only be non-participating, get paid less, but then also you have to deal with balance billing with the patient. So you'd have to actually ask for the rest of the payment from the actual client or patient. And a lot of practices, physicians do not like that type of billing towards the patient. And so with that said, I'm going to read out what a non-participating provider is. And so unlike participating providers who are paid the full Medicare allowed payment amount. Non-participating physicians who take assignment are limited to 95% of the Medicare approved amount. In 2018, 99.6% of the fee schedule claims by non-participating providers were paid on assignment. So that just means, obviously, there's a very tiny fraction of providers out there, physicians out there, not accepting the full payment from Medicare as paid in full. To read on here, physicians who choose not to accept assignment can charge beneficiaries more than the Medicare approved amount, but not exceeding 15% of the fee schedule allowed amount. So now this gets into where the physician is now billing the actual Medicare beneficiary patient, and they can obviously balance bill up to a set rate, up to 15% more. Did you know that 8 states make it illegal to charge excess charges? And that's what these would be called. They'd be called excess charges. So many states do not approve of it. It makes it illegal, and many practices, physicians do not like to balance bill. So Medicare patients are financially liable for the additional amount. That's called balance bill, plus applicable deductibles and coinsurance amounts. So those are the two main designations when talking about Medicare providers. And so I want to make this point because original Medicare is basically national insurance because of the amount of Medicare providers that accept assignment in the United States. Over 97% is the vast majority. That's over 1 million physicians, practitioners that bill Medicare directly. And it's the largest payer of medical services, supplies, and durable medical equipment. So just note how big Medicare insurance is when you're signing up with original Medicare Part A, which is inpatient, and Medicare Part B, which is outpatient coverage. And so the last thing I'll say here is that the last designation is if a physician is opting out as a provider. So physicians and practitioners under this option have signed an affidavit to opt out of the Medicare program entirely. Instead, these providers enter into a private contracts with their Medicare patients, allowing them to bill their Medicare patients at any amount they determine is appropriate. Of note, providers who have opted out of Medicare program must opt out for all their Medicare patients. Medicare patients seeing providers who has opted out of Medicare program must sign an agreement and agree to be financially responsible for the entire cost of any services received. So that doesn't sound very nice when you've been paying into the Medicare program via FICA taxes all your working years for 40 quarters or approximately 10 years. And so just to finish out here, neither the provider nor the patient can submit a bill to Medicare for reimbursement. So even if you're a Medicare beneficiary, if a provider has opted out of the Medicare program, they could not submit a bill, and nor can you submit anything to Medicare for reimbursement of a bill. So what they're talking about here is clinics that are self-pay or direct pay. And so if you're going currently to a direct pay facility, they typically have subscription programs for you, and you feel as if you're a part of that one or two or very small facility of services, whether it's just a few doctors, but they do have a place because a lot of folks like to just have self-pay or direct pay when you're under 65 because of major medical being so expensive for a lot of folks. So I hope these definitions have helped enlighten you on participating and non-participating providers. The third one is opt-out providers that don't that don't participate in the Medicare program entirely. And so just note, if you're on original Medicare, you have national coverage. Basically, if you're on a Medicare Advantage plan, you have participating providers. It's more restrictive in nature. Like an HMO will be around 7,000 providers that include, physicians, clinicians, as well as participating hospitals. And a PPO will be a little bit larger, like around 46,000 plus or minus of participating physicians, hospitals, and clinicians. And so nothing is as big as original Medicare because it's been a national health insurance program since 1966, with 97% of the vast majority of physicians and practitioners billing Medicare that are participating providers. So I hope this information has helped. Please let me know if you are trying to decide your path on your Medicare journey. It's very, very critical that you understand that there are pitfalls if you're trying to make sure that you have really good coverage at the very end of your Medicare journey. A lot of folks see that they have a lot higher utilization and need for original Medicare when they're getting into their later years on their Medicare journey. So let me know of any questions that you may have for your current providers. If you need anyone to look that up for you, we're an independent brokerage out of Charleston, South Carolina. We're called Medicare Savings, and we help folks with the Medicare information that you need hassle-free, especially when you're shopping your Medicare insurance options. So take care. God bless. I hope to hear from you very, very soon.